Good morning, everyone. My name is Judy Blake, and I am the Leadership and Advocacy Coordinator for Family to Family Network. We are in Houston, Texas, where it's a beautiful day here, and we are very happy that there is very little humidity. Yay! So I am with Family to Family Network, as I mentioned, and we are what I call tiny but mighty. We are an amazing nonprofit, and we serve families who are impacted by all different types of disabilities in the greater Houston area. This is one of our Wednesday training programs, and we are very, very happy to have with us Dr. Rachel Fein from Baylor College of Medicine, as well as Morgan McNeel, also from Baylor College of Medicine. They have a wonderful, informative, and very helpful presentation on tips to potty training. So I can tell you that I am the single parent of a 30-year-old son, and I also have a 26-year-old son. He has disabilities that include autism, obsessive compulsive disorder, Tourette's, intellectual disabilities. And the reason that I want to share that with you is so that there's a connection, and you know that I'm just not doing this as a job. I do this because it matters to me, both personally and professionally. I know that I had so many challenges with potty training with my 26-year-old. And finally we were successful, but it took a long time. And that was back when we didn't have internet, if you can imagine back that far. So I'm going to go ahead and have Morgan, go ahead and share your screen, if you could, please. There you go. So we ask that you hold questions until the end. There's a lot of information that Dr. Fein and Ms. McNeel want to go through. So please hold your questions until the end, and we will allow time for that. If you don't feel comfortable asking questions, please send the question anonymously in the chat to either myself, Judy Blake, or my amazing colleague, Christina Zavala. If you are Spanish speaking, Christina is bilingual, one of the many reasons that we love her. And you can send her your question, but know that this is a safe place. No question is silly. There is no judgment here. It is a judgment-free zone. We want to make sure that we help you, and that is why we have these trainings. We all may have differences of opinion, but we need to respect each other's opinions. So just know that you can ask any question and it's all good. So thank you so much, Dr. Fein and Morgan McNeel.
Thank you so much, Judy and Family to Family Network, for having us today. We're really excited to be talking about this topic. Just a quick little background about myself. So I am a child psychologist. I'm also a board certified behavior analyst, and I work within the Myers Center for Developmental Pediatrics and Autism within Texas Children's Hospital. And so some of the things that I do is provide comprehensive psychological evaluations to determine if children meet criteria for autism. And then I also spend time doing parent training for families who have children with autism and then co-occurring challenging or disruptive behaviors. And if I've had the pleasure of working with Morgan McNeel, who is an advanced graduate student in the school psychology program at the University of Houston, and she spent a year-long rotation with me providing parent training, and we spent much of that time working on toileting with many, many families. So we're excited to talk with you today. And so today we're going to be discussing different aspects of toilet training. And so by the end of today's presentation, you'll have an overview of the toilet training process, different considerations when considering whether it's the right time to start or what to do when you're in the middle of it, common toileting concerns and ways to address it, as well as different issues that can kind of force things to go wrong and what we can do about them. So before we get started, I really just wanted to emphasize that it is never too late to start the toileting process. Or even pick it back up after you've experienced some unsuccessful attempts. But it's also really important to consider if your child is ready, and then also if you're ready before taking on this process. which is something that we're going to discuss in more detail in just a little bit. We also wanted to emphasize that this approach and process and strategies that we're going to discuss today are really meant for anybody and everybody. I know we got a question at the beginning about the age, and you're in the right place for that. It's not just for a certain age, it's not just for a certain language level, even though most people, when we discuss toilet training, often think about toddlers. We're not talking about just toddlers, we're talking about really anybody. But you'll hear us use the phrase your child throughout the presentation today to really just kind of capture everybody of any age level. So just know that we're referring to any individual of any age level and ability as well. And so something else to consider is that people start this process at different places, and they also have different end goals. So we're going to spend some time discussing that as well. And also, as I mentioned, that end goal is going to look very different for everybody. And so because of this, toileting really does require a very individualized process and approach. So please keep that in mind. So I'm going to encourage you also to really tune out anybody who tells you that you just have to do this one thing, or, never do that thing. And try not to get too discouraged if you try something and it doesn't quite work the first time, or if it doesn't work for you in that moment. We really just don't want you to get too disappointed or discouraged, because it is possible to toilet train children of a variety of ages and abilities. So we're going to go over the key components of the toilet training process, because we want to make sure that everybody has the same foundational skills by the end of this presentation, because I know that everybody might be in a different starting point or place. And we realize we're going to get a lot of questions about, but I've already tried that, or, but what about this situation? And so we're going to encourage you to wait till the end of the presentation, hold your questions. We're going to leave some time at the end, because likely we will get to some of those questions at some point during the presentation. All right, so this is the big question. So where do I begin? So a lot of people talk about toileting readiness or toilet training child readiness. And they might think that there's some sort of checklist that you just have to go through. Like, as long as I have like 1 or 2 of these skills, or 5 out of the 6 skills, I'll know that it's time to start. And that's really just not the case. There are certainly behaviors that will make the process easier, but we'll talk about which things that you actually need to pay attention to. And so because of that, we really don't talk about it in terms of like child readiness, because it's not so much about if you should start, but kind of where you should start. That's really much more important. So what is actually an important first step before developing a toilet training plan is you got to gather information about where your child's skill level is at across a variety of different areas. And this will help inform where you start. So there's a lot of different things you're going to want to ask. And one of the first things is, how does my child communicate? Or do they communicate when they need to go, when they're soiled or wet? Will they even sit on the toilet? And if so, for how long will they do that? Have you actually ever tried removing their diaper or pull-up from them during the day? Have you tried putting underwear on them? Do they tolerate this? What is their schedule? Is it predictable? Do you know at certain times of day that they pass a bowel movement or urinate? How long can they generally stay dry? And how are they with certain toileting self-help skills? So can they pull up and down their own pants? Do they require assistance for this? Can they flush the toilet? Do they know how to wash their hands? And then also thinking about behavior. So a lot of times when we're working with families, one of the big questions is, does your child engage in things like tantrums, physical aggression, non-compliance? And the reason why we ask this is because if you're seeing it outside of the toilet training process, you're likely going to see it during the toilet training process as well. So we want to make sure that you have a good plan and know how to manage those things outside of toilet training to make it a lot easier. The other question too is, are you ready? And this is a general question, but some of the key things to think about are, do you have the ability to commit 1 to 2 hours per day, at least in the beginning, or an entire day? Do you have the ability to dedicate an entire weekend, a week, 2 weeks? And the reason for this is because when you start this process, it does require some undivided attention. And we want to make sure that you think about these things and you have the support, whether it's for yourself or for your family, or if you have other children, so that you can commit to this, because it can be really challenging. And so those are some things to pay attention to, because it requires a lot of consistency. All right. And so when we think about the toilet training process, we often think about, well, is my child going to let me know if they need to use the bathroom or not? So we think about teaching toilet initiation first. And then we think, okay, well, once we got that covered, we're going to focus on nighttime training after we've gotten everything covered during the day. But in reality, what happens is we kind of need to back things up a little bit. We need to make sure that we have a good grasp on these key toilet training steps. So one of the big things we're going to talk about today is how to go through the process of scheduled sittings and all of the different pieces that surround that. And then sometimes we have to back it up even a little bit further and think about what are those prerequisites for toilet training. So I mentioned readiness earlier, and I don't love that word because I feel like that can mean so many different things to so many different families. But what I can say that you do need to know for sure is your child willing to go into the bathroom and be in there willingly? The second is, can they sit on the toilet? Because if they don't have those two skills, it's going to be really difficult to move forward. And so you're going to want to make sure you have those things ready and achieved before you move forward with the toilet training steps. So now I'm going to turn it over to Morgan, because she's going to go through this process.
Yeah, and we'll get into talking about some of those strategies for teaching those prerequisite skills, but we want to first spend some time talking about those basic toilet training steps. So what you see under number 2 here. And these key components are listed here, and this honestly really simplifies it, right? You look and it's like, okay, this makes it look pretty simple. And we're not saying that this process is just for easy steps. There are nuances within each of these components that we'll get into in a moment. But before that, you might be wondering, like, okay, but will this work for my kid? And the answer is yes. So the modern toilet training methods date back to the 1930s. People have been using these strategies for toileting for a really long time. And these components have been found to be effective for learning and then maintaining toilet training skills. And they're supported by years of research. And that research is both with typically developing children as well as children and adults with intellectual and developmental disabilities. And while these components will look different and present unique challenges across individuals, they make up kind of a basic formula for toilet training for anyone and everyone. So let's talk about kind of each one of those components in a little bit more depth. So the first one is increasing fluid intake. So you need to increase your child's fluid intake during the initial phase of toilet training in order to increase the chance that they'll actually have to go when you place them on the toilet. So you want to offer their favorite liquids about 30 minutes before the toilet training begins. So think about kind of what low-calorie drinks your child will drink a lot of and offer that before the process. And then you also want to remember to taper the liquids back down if they need to leave the house later in the day, and also discontinuing that high fluid intake about 2 hours before bedtime. And we offer specific time guidance here, but these are really just suggestions and a good place to start. This isn't an exact science, it's more of an art, and you might have to adjust the when and how you increase fluid intake based on your individual child. The next step is determining how often you should prompt your child to use the toilet and have those scheduled sittings. And the amount of time will probably range from 30 to 60 minutes, but it really depends on your child's natural toileting patterns. And you're gonna look back at that data collection to think about, okay, how often do I need to start prompting them to use the toilet? And then think about how you're gonna remind yourself to do that. So using clocks and timers can be really useful because you can just set those reminders like, okay, it's time to take them to the bathroom again. So at the end of each interval, you're gonna prompt them to ask to use the bathroom. And you can use a number of different kinds of prompts. So you can use words, a sign, a picture, or an alternative communication device. And you can also physically guide them to go to the restroom as well. And that's teaching your child to start making the request on their own. You're pairing that communication with the act of going and doing that scheduled sitting. You should also prompt them to go to the toilet if you notice an early warning sign, like some kids will do the potty dance or like squirm in their seat. So if you notice those early signs that they have to go, that's another opportunity or a time where you should physically guide them to the bathroom and prompt that process. And anytime they independently indicate in any way, any form of communication that they need to use the bathroom, praise that and immediately take them. And then once your child is at the toilet, have them undress and sit down and note whether their undergarments are dry or wet. And if they're dry, praise them for having dry pants. And then if they're wet or moist, comment that they had a bit of an accident and then continue with the procedure of having them sit on the toilet, even if they already went. And then with your supervision, they sit on the toilet for 1 to 3 minutes, unless they go immediately. If they go, they can get off. But if not, have them sit for 1 to 3 minutes. And try to not extend this time beyond 3 minutes, because we don't want the bathroom to become unpleasant for them. And having them sit for longer tends to not be effective. You also want to think about providing the right reinforcer at the right time. That's a really important piece of the teaching process. So think about what reinforcer you can give them for using the toilet appropriately. It can be a toy, a game, a preferred activity, a special food item, or free time, as long as it's something that's highly desirable for them. And it also has to be contingent on the behavior. So what that means is that they don't get the reinforcer except for this specific behavior of appropriate toileting. And they also receive that every time the behavior occurs. It's also important that this reinforcement is given immediately after they've urinated or had a bowel movement in the toilet. So you might find it helpful to keep the reinforcer in the child's view, or use a verbal or visual prompt to remind them what they can earn for doing the behavior. And even if it's not in the child's view, it needs to be close by so you can deliver that reinforcement immediately, because we really need them to pair that reward and that reinforcement with the behavior. And when it's happening immediately, they're able to make that connection. They're more likely to make that connection. And if they sit but not use the toilet after standing and getting dressed, don't provide praise or other reinforcement. Simply just tell them that it's okay in a neutral manner. Like, it's okay, you didn't have to pee. The other important piece is how you respond to accidents. So the first thing that you want to do is to make sure that you can notice them right away. So you might want to have them wear only underwear and a shirt, or even no underwear or pull-up at all for the first phase of training. And then as soon as you see an accident starting, you want to interrupt them. And this shouldn't be a reprimand, but it should be obvious and kind of startling correction. So no, hurry up to the toilet to pee. And then you prompt the child to go to the toilet, undress, sit on the toilet, and then encourage them to go. Similar to those scheduled potty breaks, if they go, give them lots of praise and encouragement. And then if not, prompt them to get dressed and then kind of go back to the scheduled sittings. If the accident occurs within 5 minutes of a scheduled sitting, that particular break should just be skipped. And it's really important to note that this prompting procedure, which is used at the first sign of an accident, can only be successful if the child is in close proximity to you and you both are close to the bathroom, because otherwise it's impossible to interrupt the accident and get them to the toilet on time. So this comes back to the, like, are you ready? do you have that time to give this process that undivided attention? So what happens if the parent can't always be near the child during toilet training? If that's the case, the accident prompting procedure probably won't work because they're going to have already gone completely before the parent notices. And then if that does happen, it's best to just simply change their pants in a neutral manner and be careful to not provide too much attention to that whole process. And then finally, with accidents, some parents have the child assist in the cleanup. And if that's the case, in a neutral manner, the child might be asked to place his dirty clothes in the washer or wipe up any urine or bowel movement off the floor and put on clean clothing.
All right, so now I'm going to talk about just a couple of helpful tools and tips that might assist with some of the previous components that Morgan discussed. So one of the things that we often recommend is making a visual. We don't necessarily recommend relying on the visual, thinking that this is going to be the thing that helps get your kids toilet trained, but it's certainly helpful. And with a lot of families that we've worked with, it's a helpful visual for the children. So what's nice about it is that the pictures can create this reminder about what's to be expected. So you can see here, there's some different examples of all of the different steps. Sometimes children, depending on their age, might benefit from having little kind of cartoon pictures. Others might benefit from actually their parent taking a picture of what their actual bathroom looks like, whether that's at home or at school, and making sure to place them in order. So it really doesn't matter whether you do it from left to right, top to bottom, whatever makes sense for the unique needs of your child. There's also lots of websites, like you can tell these are board maker pictures, which is like a very expensive program that most schools and therapists have, but families typically don't have access to this, nor we would expect them to. But you can easily just go to Google Images or go to websites that have some of these free resources. There's also like Teachers Pay Teachers and other websites like that where you can have one already made for you. And then another helpful tool is using what we call like a first then board. And the idea behind this is that you are providing a visual cue of what the expectation is, but then also that they receive some sort of reinforcement for the expected behavior, as Morgan discussed previously. So you can see there's a picture of the toilet. And then for the first one, there's like a menu of rewards. So first toilet, and then the child could choose bubbles, or first go to the potty, and then they could have some candy. And then there's some other examples here on the right of different ways. So having a cartoon picture versus a real picture. And some other options are having social stories. So what's really nice about social stories is that you can create an individualized story that basically illustrates what the expectations are of going to the bathroom, both at home and public and at school. We included a couple of examples here. There's also a video that I actually really enjoy and share with a lot of families that I work with that's free on YouTube. You can literally Google potty training social story, and it goes through the process of going to the bathroom. And then on the right-hand side is actually an example of the social story I used for my son for toileting at school. We were able to successfully toilet train at home, but school just looked really different than home did. And so we needed to create something that was individualized to him. So now we're going to share some of the common toileting concerns beyond the typical components that Morgan went over with the toilet training process. So, and I'm just looking at time here. Okay, perfect. So we have some of these are, I would say, the four most common concerns that I typically run into, as does Morgan, when we're working with families. The first is refusal to sit on the toilet. And this could involve they have tantrums as soon as you put them on the toilet. It could be they're never actually relaxed enough to go. So they often sit and then hop right off. It could be that a child won't even enter the bathroom. Like they might do it to take a bath, but as soon as you mention the word toilet, they run for the hills. The second area is diaper toileting rituals. And so what we found is this is typically related to passing bowel movements, but it can happen for urine as well, where children just get very attached to their pull-up or their diaper, or they have a very specific spot in their home where they typically will pass a bowel movement. A common one, for instance, is children hiding behind curtains or going to a very specific bedroom, or like basically crawling into a closet. Those are all different examples that we've run into. The third common toileting concern is relying on scheduled sitting. So as Morgan discussed before, we talk about scheduled sittings in this very systematic way where we prompt the child to go unless they initiate it on their own. What we do find is there are some kids that have no problem staying dry, have no problem going at the scheduled times, but they just don't initiate on their own. That's a common concern. And then the last area is training for urine, but not bowel movement. So what this means is kids have no difficulties urinating in the toilet, but for some reason, they just have a challenge with passing bowel movements. And that's sometimes an area that parents get stuck in. So the first area that I'm going to talk about is refusal to sit on the toilet. So there are two main strategies for this. I'm going to talk about the first one now. So the first one is shaping. And so if you haven't heard of this before, shaping basically means you're setting up that requirement for a target goal, like sitting on the toilet, and you gradually increase that requirement over time. And so you first want to figure out, how long can my child sit on the toilet? How long are they willing to sit? And you figure that out by collecting some data. So you'll basically try to get them to sit about 4 or 5 times, and you'll take the average of that amount. And so if on average, they'll only sit for 10 seconds, that's your starting point. If on average, they'll only sit for 1 minute, that's your starting point, and so on and so on. You then want to identify a really strong reinforcer. And you're going to reinforce the child, not for avoiding in the toilet, but for sitting on the toilet. That's where you're starting off, and that's okay. So you want to figure out something that's going to be super motivating for them just to sit. And then you're going to want to use a timer to help support this strategy. So first you might say, I'm only going to have my child sit for 10 seconds. Once the timer goes off, they can get off the toilet, and they also receive some sort of reinforcer. And as you see progress with this, you're going to continue to increase this time gradually up until you know that they can sit for 3 minutes, so that you can start that toileting process. But the thing to remember is, if your child gets up before the timer, they don't get the reinforcer. And then also, while the child is sitting, you don't just have to stare at them. It's not meant to, we're not in the business of torturing children, but what you do want to do is create a positive environment. So the child can read a book, they can listen to music, they can play on their tablet, they can put stickers on the wall, whatever is going to be enjoyable for your child while they're sitting to keep them busy, go for it. The second strategy for refusal to sit on the toilet is something that we call escape extinction. And this is appropriate for children who have essentially learned that if they cry or scream, that their parents will say, oh, we got to get rid of this sitting on the toilet business. And so we would want to address it this way. And so essentially what you would do is you would set a timer for a few seconds. And what I mean by that is like 5 or 10 seconds, and place your child on the toilet. And you basically want to gently keep them there until the timer rings. And once again, you can involve your child in whatever activity they want the kid to engage in for 10 seconds. So putting, looking at a book, stickers, whatever. And when the timer goes off, they can get off the toilet. Basically, the idea is that we're changing things up. They don't get to leave the toilet for screaming. They get to leave when the timer goes off. And so once they are consistently sitting on the toilet, and going back to that 5 to 10 seconds period of time, like 10 seconds without screaming, we're going to gradually increase it. Maybe we're gradually increasing it to 15 seconds and increasing it a little more. And it's a slow process, but it is effective if you can stick with it and be consistent. And then finally, for some children, toileting has become, for whatever reason, so aversive that they just avoid going into the bathroom altogether. Some children are really, really smart and figure out, this is going to be a problem if I hear the word potty. Others just are like, nope, the bathroom is not for me. I'm not going in for any reason at all. If this is the case for your child, you can use the same shaping procedure that I just mentioned related to sitting on the toilet, but it's going to look a little bit different. So instead of focusing first on sitting on the toilet, now our goal is moved back a little bit. Our goal is just to get your child closer and closer and closer to the bathroom. So for instance, it might be our goal is when I say it's time to go potty, your child moves to the doorway of the bathroom. Now, once they successfully do that, we're increasing that requirement. Now they have to step into the bathroom. Now, perhaps they have to put their hand on the toilet. Now they have to sit on the toilet fully clothed with the lid down. Now they're doing it with the lid up, and so on and so on. So we're gradually making moves towards being in the bathroom and then eventually sitting on the toilet.
And then you can also use that similar shaping procedure to address the diaper and toileting rituals. So if they're refusing to sit on the toilet, maybe they're going to find a quiet place to go in their pants or in their pull-up, or they might just kind of always request a diaper or pull-up when they have to have a bowel movement. So for this, you'll use that shaping to reinforce gradual steps towards your goal using, again, a strong reinforcer, something that's really motivating for your child. So for toilet or bathroom avoidance, you want to work towards requiring them to be in the bathroom for that bowel movement or urination. So if they typically go to a certain item or a certain area, it can be helpful to move the item or something from that area to the bathroom. So for example, if they always go to like a certain armchair, like even physically moving that armchair or maybe a pillow from the chair physically into the bathroom, and then you're going to gradually work towards them having that bowel movement, maybe on the like they're sitting by the pillow before they're getting on the toilet, and you're going to reinforce those gradual steps. And then for diaper rituals, you're going to continue to provide the diaper or the pull-up when your child requests it, and gradually work towards them having them sit on the toilet in their diaper while going. So you can the first goal might be sit on the toilet with the lid down and still go in their diaper. And then once they're sitting on the toilet with the lid up, you can cut a hole in the diaper or fold it back so that they go in the toilet. And then you continue to just slowly do that, cut a little bit more, fold it back a little bit more until that's no longer necessary. And again, continuing to reward those gradual steps using something that's reinforcing for them. And then those later steps can be a big step, going from, sitting with the pillow on the ground to sitting on the toilet. So you might have to use a stronger reward. And in addition to rewarding the child after they go, consider what activities they can do while they're sitting to make it a more enjoyable experience, like Dr. Fein was mentioning earlier. Another common issue that comes up is, okay, they're going consistently in the toilet, but they're still requiring prompting. So in order to teach your child to initiate going to the bathroom on their own, you want to gradually increase that time between the toileting prompts that you're giving, and then also having them near the toilet when they're likely to use it. You may have to use different reinforcers for like actually going in the toilet when prompted versus spontaneously making a request. So you want to have a stronger reward if they request to use the toilet and then go, versus if you prompt them and then they go. And then they can use any mode of communication to communicate that request with you. And then you also, once your child begins to make clear requests to use the toilet and successfully uses it after those requests, or independently uses it without a prompt, you want to slowly start to fade out the scheduled toileting, those scheduled sittings. So maybe you're setting the timer for 30 minutes and then you move it to 45 minutes. And then during that phase, you want to continue to make sure they're kind of consuming a lot of liquids and then providing prompts at the scheduled intervals, and reinforce using the toilet independently and prompting them to go when an accident starts. and then occasionally checking on them and reminding them to use the bathroom if it's been a while since they have gone. And then after a period of several days without any accidents, you can start to fade some of those other components of toilet training, like reducing the amount or frequency of reinforcement, or having the child wear pants if they've just been wearing underwear, and starting to reduce that fluid intake. And something else that you want to start doing is reinforcing dry pants. So once they start to have regular toileting successes and you start to fade that prompting, you want to also reinforce them staying dry. So you can, instead of prompting them to have scheduled sittings, you can still keep those reminders for yourself and use that as a reminder to check their pants and praise them for being dry if they are dry. Another common concern is, okay, they're going great with peeing, but the bowel movements, we're not there yet. So if that's the case, you want to track their bowel movements to identify any possible patterns, and then take them to the toilet about 15 minutes before the bowel movement. And then 2 or 3 additional times during the day that work best with the schedule. And this is a little different because we want to have them sit up to 10 minutes, as long as they can, up to 10 minutes. And again, giving them an activity to stay busy while they're sitting. If they have a bowel movement, provide praise and additional reinforcement. If they don't have a bowel movement, you want to stay neutral, say, oh, you didn't have to go, it's okay. You can have them leave, take a 10-minute break, and then prompt the process again. So you might have to repeat that process a couple of times before they actually have a bowel movement.
All right, so we've gone over the considerations, the key components, and also the typical concerns that we run into. And also ways to address that. So where can things still go wrong? Well, the first area to pay attention to really is that consistency. So consistency truly is critical to the success of the plan. But what we also know is that toileting can be both mentally and physically exhausting. So something to consider is that if you initiate the process before you're ready, or if you don't have enough time to truly dedicate your full attention to the plan, you're likely going to run into some unsuccessful attempts at this process. Some other things to consider is that if you attempt toileting and you're very confident that you're being consistent, but you're still experiencing some difficulties, we want to pay attention to what we call like the flaws in the plan. So go back to the drawing board, go back to data collection. So think about, is the frequency of how often we're taking your child to the bathroom for scheduled sittings, does it need to be more frequent? We make this recommendation of 1 to 3 minutes or 2 to 3 minutes for sitting on the toilet. You might have a kid where they might need to sit a minute longer or a couple minutes longer. And that's why at the very beginning, when Morgan said, it is not an exact science, it's definitely an art as well, because of course, when you start toiling, you may have a beautiful plan, and then all of a sudden your child throws you a curveball, as they typically do. You also want to revisit rewards. So what we often see with families is when we're coming up with our list of rewards, families will indicate things that their child likes, but they're not strong enough. They're not motivating enough. And that's not that that's the only thing that you need to pay attention to, but we want to make sure that they're getting access to something that they only get access to for this very specific behavior for it to be super valuable. Something else to consider are medical considerations. So does your child have a history of constipation or diarrhea? Are they taking any supplements? Do they need a clean out? Do they have any sort of like, fecal impaction that needs to be addressed? And if you ever have a concern like, oh, my kid isn't having a bowel movement for more than 3 days, we highly recommend you consult your child's pediatrician so they can have a medical evaluation to make sure that they're not holding things in and it's causing them pain of any kind. And we want to make sure we're ruling out any other concerns. The other piece too is, as we've discussed before, behavioral challenges that extend beyond toileting. if, as I've mentioned before, if you are observing significant challenging behaviors outside of toileting and you're considering the toilet training process, we want to make sure that you have a plan for how to address those behavioral challenges, because you'll likely see them, or you'll likely see new things once you start toileting. So you want to come in with a really great plan whenever those things do come up. And I love this graphic because it really does reflect the toilet training process and the toilet training journey. And as with most things as parents, we have this plan of how things are going to go. And we're expecting it to be this like linear process, but in reality, that's just not the case. And specifically with toileting, there are going to be days where you're going to observe some really amazing progress. And, you know, for some families, even after a day, they're like, I got this, my kid has this, where, you know, this is smooth sailing. But always what ends up happening is the honeymoon period ends. And after a day or so, kids are like, what are we doing? What's happening here? And they're going to throw you a curveball and you're going to experience some setbacks. And what I'm going to encourage you to do is expect setbacks. It's normal to be discouraged. It's normal to feel disappointed, but don't let it stop you. Because what ends up happening is families will experience a setback and they'll pause the process. They'll say, my kid isn't ready. We're not ready to do this. But I'm going to encourage you to actually push through it, because if you've seen even an ounce of success, you're on the right track. It just takes time. It takes consistency. It takes some dedication, but it can definitely be super beneficial for your family. And so thinking about next steps, I want to look back at that toilet training roadmap and consider where to start. So I'm going to leave you with some questions. So will your child sit on the toilet? Will your child enter the bathroom willingly without any difficulties? Do you have an idea of what your child's voiding patterns are? That doesn't mean that your child has to have a consistent voiding pattern to start the process, but it's helpful to know so that you can make a tailored plan for your family. Are you ready? So do you have a plan in place for your own support, family support, sibling support? And then what is your plan? So what are those toilet training steps that are going to make sense for your child? So we went over those key components, but once again, each step is still somewhat individualized for your child. Do you know what's reinforcing to your child? Because if you have an idea of maybe one or two things that they like, we want to make sure that you're doing what we call a preference assessment. So really making sure that you have an idea of several different things, kind of different levels of interest that are going to be important and valuable to your child. Is the environment set up? So some things that we didn't really touch on, but things to consider, like, you know, where is your bathroom located in a place that's going to make sense for this toilet training process? Depending on the age of your child, you know, you may need, if they're smaller, you can get those little potties. If they're older, you might need to practice they have like those urinals you stick on the wall if you have a boy. You know, they have the potty seats. It just depends. Like you might need some railing, whatever is going to make sense for you. And then is there support or commitment among caregivers? So if you're doing this on your own, do you still have support from somebody else, somebody you can talk to about this? If there's more than one caregiver in the home, are y'all on the same page? You want to make sure one caregiver isn't undoing what the other person is doing. And so we're going to leave you with those questions because this is totally doable. It's a lot of work. It requires consistency, but it is definitely possible for families who have children of all varying ages, language abilities, and developmental levels. So we want to thank you so much for giving us the opportunity to present. And I can't believe we actually met our time goal here.
Oh, Dr. Fein.
So we wanted to leave it open to some questions for the next few minutes. So please feel free you're welcome to unmute yourself and ask the question. You're welcome to write it in the chat. I don't know if Judy or Christina got some questions.
That'd be great. Thank you so much. So Dr. Fein, Morgan McNeel, thank you so much. This was really great. Like I said, you know, when I had to do this, you know, over 20 years ago, there was no internet. You didn't have all of these YouTubes, and you didn't have chat sites. And we had, yeah, maybe one or two books, but nothing like what you see today. And what I also find that's really amazing, because we always want to be clean when we're in a bathroom, and you're at Target with your kids or the grocery store, and all of a sudden they have to go. My nephew's wife brought out this potty seat that fits on top of the potty. I mean, I was like, wow. So you're not sitting on it and having to line it with toilet paper if they don't have the liners. I was like, wow, I wouldn't know how to have a child today, because technology is so different, and there's so many gadgets and ways to make it easier for parents. Really, really incredible. It really is. So this was really great. And to all of you, we put in the chat box, and Christina put it in Spanish. Thank you, Christina, that we will be sending you the slides. Ms. McNeel, if you could please send me the updated slides, because I think the slide deck I have is the old one, and I think you updated it.
You have the updated one.
Oh, I do have the updated one. Great. So what I'll be doing is I will be sharing with all of you the recording as well as the slides, because it was a lot of information. If you have to leave, we've put the survey link in the chat box. Please complete the survey link. It's important that we grow as an organization. And I believe this presentation was fabulous. We want to know what you think. So I did get a private message.
May I ask you a question?
Sure, by all means. Thank you for joining us, Maria.
Hi, I'm tuning in from Brownsville, Texas.
Welcome.
I have a 12-year-old child, severely autistic and nonverbal and not potty trained. And I'm wondering, are there any studies that show that this method that you taught here today will work even with older children?
Yes, absolutely. So I don't know if you were able to see, but on one of the slides that Morgan presented, she did include a citation. I forget the author's names, that did a review recently of the research with toilet training. And interestingly, like some of the toilet training science was actually implemented originally with adults that had intellectual disabilities. Because there was such a gap for families who, had individuals that were living with them where they could be toilet trained. But like Judy said, there was no internet. There were a couple of books. Most people kind of just did whatever their parents did or hoped their children figured it out eventually. But that's a great question. So this process does work with older children and individuals. And my original experience too, right now I typically specialize in preschoolers, but my original experience when I was becoming a BCBA was working with adolescents with autism and intellectual disability. And so we use this process too for toilet training within families' homes.
Wonderful. And then just one more question. Are you all going to email us
Yes.
the link of the recording?
Yes, I will send that. I will definitely send that.
You want to watch this again? I'm sorry. Go ahead.
Yeah, no, you're fine. And my computer has like a delay. And so I thought you were finished. My apologies. I didn't mean to interrupt you. But yes, I will be sending you these slides as well as the recording in the next day or two. So yes, absolutely. Because I know it was a lot of information, step 1, step 2, and when do you reinforce and when do you not reinforce? So another question that we have is, any advice on training siblings? 3.5-year-old, developmentally delayed and showing little interest, only shows interest when her sister does, yet she doesn't go. And 2-year-old girl showing interest in using the toilet occasionally and will soon be ready to actively train. Do I train both at the same time? I don't want to force and make it stressful on the 3.5-year-old if she isn't ready, but I don't want to delay the process for my 2-year-old if she is ready. Great question.
Yeah, that's a great question. And obviously I don't know the specifics of your situation, but I would actually recommend trying to do both if you can. Get it over with.
I agree.
If possible. And I find that, even if it's not super obvious to you, children are actually paying attention to what their siblings are doing. And so especially if you have one child that is motivated, let's use that to our advantage. And the process, once again, it might look different for the two of them. And your 3.5-year-old might show some signs that, hey, I don't really want to be doing this, but it doesn't necessarily mean she's not ready. And so I want to make that super clear, because I think that sometimes is a common concern. Is my child ready? I don't want to rush them. I don't want to pressure them. And like I said, if your child can walk, if they can carry a toy from one room to another, if they can enter the bathroom, if they can sit on the toilet, even for just a couple of minutes, those are some things that I would be paying attention to about whether you can start the process or not.
Thank you so much, Dr. Fein. We have 3 people who have questions. I'll go in the order on my screen, and then I'll get to the other ladies. Iran, you had a question first, I believe?
Yes, ma'am. I'm from Brownsville, Texas. My son, he's 5 years old. Every time he has a little sign that he gives me when he's going to have a bowel movement, he picks up his shirt. He does suffer constipation. I've gone to the pediatrician and he refuses to give me anything. My son's really good about eating vegetables. He drinks pretty much only water. And I guess it's just something that he suffers of. I have tried to sit him on the toilet and he pops up right away. And if I still try to sit him, he will hold it another day or 2 before he actually has a bowel movement.
That is so hard. I'm so sorry that you're dealing with constipation. That is really, really rough. Did I hear you correctly? You said the pediatrician wouldn't give you anything for it?
No, he told me that I just need to give him more vegetables. I'm like, he does. He eats any vegetables. He even eats raw onion. He just, I don't know. I'm like, I suffered of constipation at an early age, and so did his dad and everything. So I'm not sure if that's something hereditary or not.
Right.
But I don't know. It's just very frustrating. I've even had to give him Benefiber to see
Right.
if that helps him a little. He was recently diagnosed with autism. I do have an appointment tomorrow with the behavioral specialist. So I'm going to see if maybe she's able to give me something, because one of her things that she had told me in the past to do was to give him a balloon when he was on the potty. That didn't help.
So I hear what you're saying. I would definitely connect with your behavior specialist that you have. So you technically don't actually need a prescription for Miralax. I'm not a medical doctor. I am not here to give medical advice, but Miralax is an over-the-counter, very common supplement used to address constipation. Is very effective. Like,
so you think I should try the Miralax instead of the Benefiber?
I can't speak to that. What I would say is that if you can consult with another sort of medical professional who can give you advice on that, I would or even go to your local pharmacy and just say, hey, my child suffers from constipation. What would you recommend? They can give you that advice, and they'll tell you which aisle to look on, because your child should not be suffering from constipation unnecessarily. And that can really create a roadblock.
Yes.
Figuratively and literally, for the toilet training process. And that just shouldn't be the case. And especially if y'all have a family history of that, for some kids and adults, I'm sorry, I'm so happy that he eats onions in a vegetable diet. That's just not going to be enough for them.
Yeah. Oh, he eats. Oh my gosh. I'm like, he eats more. It's sad to say, or it's embarrassing to say, he actually eats more vegetables than I do, because I don't like cucumbers, and he eats cucumbers like, oh my gosh. He loves coleslaw, like stuff. People look at him and they're like, he eats all that? I'm like, yeah. I'm like, he
Maybe
loves
he can have a chat with my son. That would be great.
Yeah. No, and I agree with you, Dr. Fein. I think Miralax is great. And also ask the pharmacist about stool softeners.
Okay.
If your son doesn't want something like a Miralax. I don't know either. I'm not a doctor either, but I would a good pharmacist can be one of your best friends.
Okay.
100%.
Yeah.
I
Thank
just
you.
wanted to add
Good
one
luck.
Thank
thing.
you.
My son had the same affliction, and luckily near me we have a pediatric gastroenterologist, and it ended. We did a colon flush that was overnight in the hospital. Found out that he has a weak colon,
Oh.
and that's what his problem was with constipation. Miralax makes little mix-ins that you put into water,
Mhm.
and we use just they're really big ones, so I only use half of it into a bottle of water, and that has helped him tremendously.
Wonderful.
Okay.
So I don't
Thank
know
you.
if that might help you or not, but it's a night and day with our issue with that. Yeah.
Thank you,
Okay.
Laura.
Perfect.
Yeah.
Thank you very much.
And
Thank
something else just to add, and Laura, thank you for sharing that, is kind of similar to toileting. Like the whole laxative process is also not an exact science. And
Mhm.
so the you might have to mess with the dosing, and that's something to ask the pharmacist about.
Mhm. Absolutely. Rosie, you had a question as well, I believe.
Yes, hi.
Hi, thank you.
I'm from Mission, Texas, and yes, I heard the ladies mentioning Miralax, and it is very effective. My daughter is 18. She was born with Down syndrome, trisomy 21, and we found out about the autism when she was about 6 years old. And she's also got some visual impairment. So she's got like a dual diagnosis. She does a lot of the extensive stemming. Anyway, going back to the Miralax, she had a lot of constipation issues. It was very severe, where she ended up in the hospital. She had the fecal impaction, and her doctor, the PCP, highly recommended the Miralax, and that has worked wonders. And she also eats a lot of vegetables, The fluids that she recommended for putting the Miralax in is like juice in the morning, or some cranberry juice. We use the diet one. So anything just to, give it some flavor. But she's come a long way with that as far as the constipation, and the Miralax is wonderful. What I wanted to ask, in my situation, she's 18. And I think I missed out on some of the information, but I was trying to write everything down.
We'll
I'm
send
glad
you the
I-
recording. No
Okay.
worries.
Where she is at right now is the steps 3 and 4, teaching toilet initiation, which I've learned that if she's sitting down like eating, I don't set a timer, so I don't know if you still recommend the timer, but she's sitting down, and at first she'll like do some behavioral issues, she'll kind of like make like a fussy noise or something, and I'll tell her, Melinda, I don't understand that. Can you please talk to me? And then she'll say bathroom, or I gotta go poo poo, or whatever it may be. And so I was told that to use like a 1-word prompt, and then stand up and then go to the bathroom, which she has done. She'll follow me. But when she's in the bathroom, I'll give her, up to like 10 minutes, depending, and I'll check. But sometimes she'll finish beforehand, and she won't initiate like grabbing the toilet paper on her own. I'm trying to get her to go on her own completely, because I'm trying to get her to do volunteer work, or maybe even work on the side. And that's one of the things that they're requiring, that she become like totally independent in the toileting process, excuse me. So do I still initiate? My question, I guess, would be, do I use timer? Do I use visuals? I don't use any visuals, because I would like for it to be, the same situation across the board, here at home and at school, because she's in the 18+ program right now. I don't know if that makes sense.
It makes total sense. That's a really great question. So I'm hearing a couple of things, that she is relying on scheduled sittings, but seems to be doing well with that, which I'm so pleased to hear. But some of the pieces that we're wanting to work on are getting her to initiate the toilet training process, and then also some of the kind of adaptive skills associated with toileting. So like getting the toilet paper to wipe herself, and she still require prompting with that. Is that correct?
Yes, that's correct.
Okay, perfect. So Something for her that might be helpful is if, and I've seen this with a lot of kids actually, is even some sort of like they have watches that you can get on Amazon that, that are basically just a timer. And so you can set it for whatever interval. And perhaps that might need to be the thing that prompts her to say potty to somebody.
Okay.
Rather than realist. So she'll hear like the buzz, and then that's her cue to say potty. So that might be something to help with that. So it's less reliant on another individual, because
Okay.
you probably are not going to be the person that's with her at her volunteer or employment.
Right. Mhm.
So at least if she has that cue, if she does really well on for scheduled intervals, that might be helpful. And then the second piece is, going through what we call like a task analysis, which is breaking down the steps of a specific skill. So you may want to pay attention to what's happening in the bathroom and think about and kind of just go through the process of what exactly is it that I need to teach her, and whatever skill that is, whether it's grabbing the toilet paper to wipe herself, whether it's, pulling up her pants. I'm just making something up here.
Okay.
Take that skill and break it down into really tiny steps. And you might have to teach each of those individual steps on its own before you can teach the next thing. And also combining that with, a reward or some sort of reinforcement.
Oh,
How does that
okay.
sound to
Perfect.
you?
Perfect. Yes, that makes totally sense. Thank you so much. I appreciate it.
Of course.
Happy to help. Someone had sent me a chat message anonymously and said they have a son who is 20 years old and he's potty trained, no problem. But the issue is when he urinates, he will only sit down for it. He, for whatever reason, doesn't like to stand up. Is this okay?
Yeah.
It's getting done, I figured,
It's getting done. And
Yeah.
honestly, I know, a lot of folks that are in that situation. And I imagine there's also a lot of men that, whether they have an intellectual disability or
Mhm.
not, or autism or not, that would actually probably prefer to sit down because it's likely more comfortable, but for whatever reason, it's culturally normative for
Mhm.
men to stand up. I don't know why.
Yeah, I don't know either. Yeah, beats me. So, okay, great. Well, I'm sure she'll be happy to hear that. I think I got everybody's questions. Yes? Oh, Laura, I thought we answered. My apologies. Go ahead and unmute yourself.
Thank you. My son is 11, and I'm wondering if because we are he doesn't indicate when he has to go. We have to use adult diapers all the time. If I ask him to go potty, he does urinate, but never once has he bowel movement in the potty. Even though if we sit there for 1 to 3 minutes, all that kind of stuff, I do have to admit that I'm not as consistent as I should be. Obviously, with this is going to help a lot, but I'm wondering, one, if I should wait maybe until the Christmas break or something, because he's at school Monday through Friday, 8 hours a day. So I don't know if even if I mean, because then he's only here for like 4 hours at night, and then he's asleep, and I don't know if that's enough, if I should wait so I can do it diligently every single day during that break. And then my other question is, he because of that weak colon, he does seem to feel like he reaches into his diaper a lot. Like he thinks that he has to pull that bowel movement out with his hands. I don't know if you've ever heard anything like that before or not.
So that's a good question. Let's address the first part first. So if you're able to dedicate the winter break to that, I think that would be fantastic. But you may not have to, depending on what his voiding patterns are. So you first may want to pay attention to, does he void or does he pass a bowel movement consistently at the same time each day? Does he even do it daily? Because there's some individuals who are very regular, even like the timing, like as soon as they eat lunch, right afterwards, they pass a bowel movement. Does he do it while he sleeps? Like there's some children that do that as well. So first think about that, because if that's the case, you may be able to do it over a weekend, and it's more just, the time that he does it. You may even want to consider not having him wear his diaper if he'll tolerate it, so that when you kind of catch him doing it, you can gently or quickly guide him to the toilet to do it. But if there isn't a consistent pattern, I would definitely try to spend a winter break doing it if you're able to do that, but also try to remove the pull-up or diaper, because it's just too comfortable. One thing that we didn't talk about-
he'll wait all day, and then when I put him on him, that's exactly when he goes.
Exactly. And so that's like, it's like a safety blanket almost, I would say, for a lot of individuals, because it's comfortable. It's something they've had from the moment they were born.
Right.
So we're asking them to do something different. And of course it's going to be,
That's hard.
different. It's going to be different.
Yeah. Underwear, he just lets me put it on and it's off within a minute. He will not wear any kind of try. So
Will he wear clothes without underwear?
oh yeah. He's a boy. He wants to be naked all the time. So yeah.
That's actually great. That's great. If you could even just keep the underwear off and have him wear clothes, if he's okay with that, or be pantsless at home, go for it.
Okay, sounds great. And
Thank you. Great question.
Thank you. With the other question, have you ever had any?
So I haven't had experience with that specifically. More so just individuals that are kind of reaching in, and it's kind of fun to play with, and it's
I'm wondering if it's a sensory issue that goes along with his autism. Yeah, that's what I was
so that's what my question was going to be. If it's related to, if you're thinking it's related to kind of his medical condition, or if it's more of like a sensory seeking experience.
I wasn't sure. I was thinking sensory, but that's why I wanted to ask you to say, oh no, that's something that we know all about, but no, that's just him being.
Yeah, and if that's the case, typically what we would recommend is, when you see him do that, just kind of quickly redirect him to do something else. So no reprimanding, no shaming, anything like that, just redirecting to something more appropriate that he can do with his hands, that's going to compete with that behavior of having his hands in his pants.
Okay, sounds great. Thank you so much.
Rosie, did you have another quick question? Because I think we have to wrap it up.
Yes, just one quick question. I'm so
Sure.
sorry. So
No worries.
Dr. Fein, is there a particular watch that I need? I know you told me a watch. Is there one in particular, like for kids for autism, I guess on Amazon, that I have to look for?
Let's see. I don't have the specific recommendation. I was like kind of quickly looking just now to see what it was, because I've seen parents use so many different ones. But this one's literally, it's not even a clock. It's just an actual timer. It's very simple. I want to say it was like less than $20 to get it. But if you just Google it, it's something, as long like a timer watch or something, or even just like kids timer. I don't have that. If I can look it up and send it to Judy. And so when she sends the slides, I can include that.
Oh, okay, perfect. Thank you so much. I really appreciate it.
Of course.
I'm sorry.
Oh, that's okay. Did you have a question, Mary Deanna?
No, I was going to tell her I did purchase a watch for my 3-year-old. I liked it because you can set up to 6 different alarms, and it sends you like a whole calendar with stickers that they can put from Amazon.
All roads lead to Amazon.
Yes.
Seriously.
So there is one, I'm pretty sure this is the one. It's called Potty Training Timer Watch with Flashing Lights.
Oh God, what will they think of next?
It's $23.95.
Yes, it's that one.
I don't get any money from this.
There's no rebate to you. I understand. So potty training watch with timer for kids.
With timer? Okay. All right.
Potty training timer watch with flashing lights.
With flashing lights. There you go, Rosie.
Okay, thank you. I appreciate it.
Absolutely. Absolutely. So we're going to wrap it up. We want to be mindful of everyone's time and of our presenters' time. I can't thank you enough for joining us today. If you're in Houston, if you're in Brownsville, if you're in Mission, Texas, wherever you are, we hope that you have a great day. Thank you so much for joining us. I will be sending the slides and the recording by, in the next day or two. So I'll add that to my list of things to do. Thank you all so much. And Ms. McNeel and Dr. Fein, if you could stay on just one moment. Thank you, everyone.
Thank you very much. Have a great afternoon, and it was an honor meeting all of you.
Oh,
Thank
we're
you.
happy you joined us. Thank you so much.
Thank you.